There were 93 new deaths in Quebec.
This is something that is a challenge in an ongoing outbreak.
540 people died yesterday.
There are now about 700,000 coronavirus cases in the United States. In Singapore, the number of cases has more than doubled over the past week.
The Red Cross is now overseeing the training of hundreds of volunteers.
Is a second wave of this infection still as easy to flare up?
18 new admissions in the past day, the number in ICU unchanged. Also, 75 new deaths reported in the province, all but 3 in Quebec in the past 24 hours have been in long-term seniors care facilities.
Now, the federal government confirms about 125 military nurses, medical technicians, and support personnel with medical training will assist local doctors and nurses.
So stay at home. Limit your trips to the grocery store to less than once a week. If you do go out, keep 2 meters distance from each other. And as you do your part, know that we're here to support you.
Our world is at war. We are fighting the invisible enemies. I am deeply touched by all the frontliners, doctors, nurses, all the medical workers, risking their life, separated from the family, working days and nights, saving lives. Thank you to all of you. You are our modern time heroes. This is like a wake-up call from our mother nature. Perhaps it's a last call to our mankind to shake up and to clean up our world, to make sure that everything that we have, that we're living in, will be a healthy environment. Our city in Montreal, Crescent Street, is the most busiest time on the weekend. Look at it now. You don't find a soul on the street. Not anywhere. But together, we all stay home. We wash our hands. We keep our social distance. We follow the rules. We will defeat COVID-19. Schools are closed. The government are in panic mode because people are losing their jobs.
Air Canada says it will have to lay off 20,000 employees, more than half its workforce.
But I really appreciate and thank you, all the governments in the world, especially our Canada, our Canadian government have stepped up. They step up and they help all the people that lose their job.
In all sectors of the economy, but certain sectors have been hit even harder. That's why we're going to keep working with various sectors. We're going to continue to work with sectors.
In my 30 years of volunteering in our community, I stepped up. I wanted to help. I wanted to help to give what I can as a volunteer. The only way that I can help now is to provide food, good, healthy meal, hot meal for all the frontliners, doctors, nurses, the medical workers, so therefore they can eat properly to regain the energy. I am very fortunate that I have a small restaurant, that our partners are willing to support my vision to help at the world crisis like this. Our restaurant will be donating food to Lakeshore Hospital in the West Island every Sunday. Anything they want. It just show our appreciation and thank you to all the doctors, nurses, and all the medical volunteers who are working on the front lines, saving lives. Thank you so much. Thank you. Really, really heart-touching moment. At a day like this, you should be with family, but they're all separated with their families, their loved one, and they're here. Really overwhelming, saving lives. Thank you from the bottom of my heart. Thank you. We're driving into Lakeshore Hospital now and for lunch, for the hot lunch, for all the doctors and nurses, and some of them they even call us and say, we are so busy, there's so many patients coming in, we have no time to eat. So we said, no problem. Anytime you guys are hungry, you miss your lunch, your supper, dinner, whatever, give us a call. I deliver. It is our restaurant philosophy. Give back to the community. It's a great blessing that we're able to do that. We continue supporting the frontliner. Now we're at the Montreal Jewish General Hospital. Right here is where all our 7 kids were born. She's the head nurse of the Montreal Jewish General Hospital.
Yes. City 7. Medicine and
So I hope you guys all enjoy the food. Thank you very much. You're the frontliner risking your life.
The nurse says the idea came to her on Good Friday when she saw a nurse's Facebook post
saying, can you please send us food? We're overworked and we have no time to go to the cafeteria.
She reached out to the community for help. She says within an hour of posting her plea online, she was flooded with responses.
They didn't call the hospital, they called me. And they said, can you help us? We're ready to donate food. And this is restaurants.
Families also contacted her. Since then, more than 30 businesses and families have been donating meals daily through her.
They separate from the family, and many of them, they don't even have time to eat.
Jess says these food deliveries boost morale.
Enjoying so much the care, the support, the love that they're receiving. I think those are the words that the nurses can't stop telling me.
My friend Wayne just came out from the hospital. He has COVID-19 and a few weeks ago, and I tell him that you stay home, don't go nowhere. Even though you're okay now, you stay home. Whatever you need, just let me know, and I will make sure that you will get your food and everything. So here I am. I'm not supposed to get near them, but there's always a way to do it. You are very welcome. This is the least thing I can do to help you guys out. I don't want you guys to come out. You stay there and be safe, okay?
Yes.
And Wayne just came out from the hospital. I just want him to be safe. Tell him to stay in the house. Don't go nowhere. You need anything, call me. I will be here for you guys. Jane,
Hi.
thank you so much for ordering the special surgical mask for me.
Yep. Thank you for coming to pick up your mask. It's for the hospitals, you know, because they are all sterile mask. And you know what? Now everyone needs a mask, but it's very important to buy the right one. You know, some governments and some hospitals, they said the quality of Chinese mask is not good, but it's not true, you know, because they did not buy the right one. If you want to buy the right one, you need to buy the surgical one and with sterile for the hospitals, you know. Yeah, it's the right one.
Thank you so much.
Welcome.
So that explains everything. So it is a special mask that have been spending how many days to sterilize?
At least 7 days.
7 days to sterilize in the factory.
Yeah.
So before they're packaging it. So that's the reason why it takes so long to shipping it from China to me today. I wanted to thank you, all the frontliners, the doctors, the nurses, all the medical workers, your dedication, your hardship. Thank you for saving lives. Thank you for taking care of our community. You are our modern time heroes. We salute you, we honor you, and we respect you. Thank you from the bottom of our hearts. And I would like to take this great opportunity to thank you, our Canadian government, by taking care of our Canadians who support us, to making sure everybody is all right, by stepping up. For your help and support, we will be okay. Thank you for all your support and help. Thank you. And I am proud to be Canadian.